Hey, what's going on? It's Stokely from Sosondole. I don't know if I'm really going to even record an episode or I'm just going to talk to myself. But let's go, the other day, not the other day, but around April, I discovered that there was a gap between my teeth. And this gap was due to cavities. Later on, I recalled that some months ago, or maybe more than a year ago, a piece of my tooth had chipped off, and I didn't know where it came from. I didn't know where that chip came from, and I started to be concerned. But the only thing I did was change my toothpaste. I didn't go to the dentist, and if I had went to the dentist, they would have gave me some form. They would have inspected my teeth, maybe offered me a filling root canal. Who knows? Whatever they're gonna offer me, And even a year ago, I was already weary about mercury, so I definitely wouldn't have got an amalgam filling. I don't think anybody's really doing those anymore because they're not. I don't know. They're bad PR. They're not marketable. And the dentist doesn't want the liability and the blame, so I doubt that anybody's even still doing amalgam mercury fillings. So, but anyhow, I neglected to address that, and as a result, it got worse. So whatever piece chipped out that caused my more recent noticing of that missing piece, I probably ate it because I don't know where it went. But last month, which is June, two additional small pieces came off also. And I did end up going to the dentist in June. In June, I went to the dentist, and I posted about that. The dentist offered me a root canal for the specific tooth in question. I think it's number 4. So the cavity that I have is called an interproximal cavity. It's in between the teeth. It's not on the surface of the teeth. Interproximal cavity between 3 and 4. And it's really number 4 that really has the significant cavity in it. Fortunately, number 3 is pretty much fine. Number 3 is fine, but number 4 is like the side of it is like missing maybe about 50% of its volume. Like 50% of it is like missing almost. So I was experiencing sensitivity to heat and cold. Still have a little sensitivity to heat and cold. So that would indicate that the enamel has gone away, and what I'm left with is either dentin or pulp. So it's enamel, dentin, then pulp, and then the nerve. So without the insulation of that crystal, the enamel, I feel the temperature directly of the food or the water or whatever, the liquid or the food that I'm consuming. So anyhow, I got scared, of course, and I'm starting to. I was feeling a little pain also. So when they inspected my tooth, like I said in my post about the holistic dentist, when they inspected my tooth, they found also that I had an infection in my bone, in the bone at the root of that tooth. And I asked, is there any way that it can heal itself? You know what I mean? And they're like, no, we gotta do the root canal. And I can't refute that or not, right? So, but they did prescribe me antibiotics, which I guess the antibiotics are to combat that situation. I haven't picked up the prescription yet. So, I wouldn't suggest anybody be as stubborn as I am or whatever, especially if you're in pain, because there was instances when I did feel pain. The last time I felt pain was maybe about 5 days ago. And when I'm feeling pain from my tooth, I don't want to do anything. I don't want to talk to anybody. I just want relief, and I just want to lay down, and I just want to curl up. I don't seem to have a high threshold for pain. But sometimes that tooth number 4, I'm not experiencing pain at tooth number 4. I'm experiencing pain at the molar on my bottom jaw directly opposite to it. Now, those teeth also have interproximal cavities, but they are very small. And what I discovered that pain to be is a phenomenon called referred pain. It's not pain at the specific tooth, but the nerves on the top teeth are tied in to the nerves on the bottom teeth also. So something could be going on with the top tooth that's causing pain, but it sends a message to the bottom tooth opposite of it, and I feel a discomfort there. So the other day, like a week ago, like 5 days ago, I started feeling pain in my tooth at the bottom, and a little bit of pain at the top on number 4. But I was feeling pain on the bottom teeth, which are not really that bad, and it kind of disabled me. It made me very uncomfortable. I was sitting down in my car, and fortunately I had a bottle of water here. I had a bottle of water here, and I put it in my mouth, and I switched it around, and I spit. And switched it around, and I spit. And what I realized, it was about 105 degrees that day. So what it seems to have happened is that when I'm dehydrated, the pain increases. When I'm dehydrated, I feel more pain. Or when I'm dehydrated, the pain comes on. Now, from my digging and talking to AI, the pulp, needs to, the pulp needs to be moisturized. The pulp needs to be moist. Now, me just swishing the water around in my mouth gave me temporary relief. It gave me relief for maybe about 2 minutes until I had to rinse my mouth again and put some more water in my mouth. But what ultimately gave me some proper relief is when I started drinking the water. So drinking the water, like, totally game changer. For the rest of the day, I didn't have any pain. Now, it's also my, observation that when I consume sugary things, especially sugary drinks, it was like basically just sugar diluted in water, I also feel pain. Now, that could be due to a multitude of things, but I attribute it to, sugar being associated with inflammation. Sugar causes inflammation. Sugar also feeds the streptococcus, I think it's called Streptococcus bacilli. Well, there's a strain of Streptococcus that causes cavities. But there's a multitude of bacteria in your mouth. You know, they say that your mouth is the dirtiest part of your body. Your mouth has more bacteria than your anus. Right? So, there's so many bacteria in the mouth. The one that deals with cavities is a strain of Streptococcus, not the flesh-eating disease one. It's a different one. There's different kind of Streptococcus, and in one of the episodes I talk about Streptococcus is one of the bacteria that I used in gene modification. The Streptococcus bacteria is used to deliver, the modification to the DNA or whatever cell that you're trying to do in CRISPR technology. CRISPR technology is the technology they use to modify the DNA of embryos to either produce like a clone or whatever gene mod. You want to change your kid's eye color. You want to do all these other things. Streptococcus bacteria is one of the bacteria that are used in CRISPR technology to modify the DNA of an embryo and do gene editing basically. And CRISPR technology got its fame from those two sheep that they cloned. I forgot what it's called, Emmy or whatever. It was done in China, I believe. And there was a big uproar about cloning technology and so on and so forth. But I'm pretty sure. Anyway, let's not get into conspiracy. So, I've noticed when I consume sugary drinks, my tooth gets inflamed also. So I think it gets those little bacteria excited and gives me trouble. Now, some sugars fight bacteria. The only one sugar that I specifically know of is xylitol. Surprisingly, xylitol comes from plants, but it helps to kill mouth bacteria. So now I've been implementing a xylitol gum that I chew after I finish my meals. And I'm doing a whole bunch of different things. So let me see if I can recall. Matter of fact, I do have a list of the different things that I'm doing. Sorry for that sound effect there. I'm doing a bunch of things in order to try to save whatever is going on with my teeth, save my tooth until I can get what I learned to be called an onlay. I'm eating maximum twice a day. I'm not snacking between meals. That reduces the wear and tear on the teeth. I brush after every meal. I wasn't doing that forever. I never did that. And I was supposed to do that since I was a child. I know when I was supposed to do that, but I never did it. I'm flossing. I know that since I was a child and I was not doing that. That's why I have the interproximal cavities, because I wasn't flossing, apparently. No added sugar treats. Now, I'll still eat fruit, but if it's a processed food or, a cake or whatever the case may be, I'm trying to stay away from that. You know what I mean? I can't say that absolutely I'm not going to mess up, but I'm trying my best to stay away from added sugar treats. No more granola bars, no more chocolates, stuff like that. And I was indulgent. I was really indulgent in sweets probably in the past year. I'm using hydroxyapatite toothpaste. So, I would suggest that everybody try to find a toothpaste with hydroxyapatite. It helps to rebuild your teeth. I'm doing coconut oil pulling. Now, coconut oil supposedly kills bacteria on contact. And supposedly, it's more effective than 1.5% peroxide. Now, you don't want to put high concentrated peroxide in your mouth. Now, people do use peroxide in their mouth. I used to use peroxide in my mouth. but I'm finding out that peroxide is just to make your teeth white. Now, right now, I'm not concerned with making my teeth white. I'm concerned with making my teeth strong and healthy. If my teeth aren't white, that's somebody else's problem. That's the person that's looking at me's problem, right? Maybe it'll get to a point where I'm feeling strong enough in my teeth that I'll, go back to my peroxide toothpaste and make it look white and all that. But more importantly, I need to have strong teeth, so I'm not doing the peroxide toothpaste at the moment. And peroxide actually is a I don't know how to say it. It basically causes free radicals. It has free radicals in it. Basically, that's what Just verify that. But it's not worth it. The peroxide is not worth it unless you're just trying to get your teeth white and you're really concerned about that. If that's your priority, then go ahead and use peroxide. If you got a bigger issue, like I do, which is a significant cavity, forget peroxide. Now, the peroxide may be the reason why my teeth were weakened, because peroxide weakens your teeth for 48 hours, weakens your enamel for 48 hours. So now I'm going to have to even talk to my family about getting rid of peroxide toothpaste, and I just bought like a 5-pack of peroxide toothpaste from BJ's the other day. So what am I going to do now? You know what I mean? We got to switch it up. We can't use the same peroxide. We can't use peroxide toothpaste anymore, in my opinion. Now, the baking soda, the only thing about baking soda, it's abrasive. But baking soda definitely helps to neutralize the acids that are excreted by the Streptococcus bacteria. But if you kill those bacteria, I think you don't have to use so much baking soda. And I see that the peroxide and baking soda toothpaste works great. The peroxide toothpaste works great. My son's teeth are like super white. But at what expense? You know what I mean? At what cost are we going to have white teeth just to be cute and then, have no teeth, or have our teeth susceptible to cavities? You know what I mean? Because, yeah. Anyhow. Okay, so I'm flossing. Yeah, I did mention that I'm flossing now, but I really only floss like maybe once a day. I'm humming. Well, why am I doing that? Humming is known to be healing. This guy's using the ladder upside down. Anyhow, humming is known to be healing. And I heard that they were regenerating teeth using vibrations in Canada, but supposedly that technology is being suppressed. It's a conspiracy thing. It's a woo-woo thing. You can kind of ignore that part about the humming, okay? Thinking positive. Now, thinking positive, of course, thinking positive is going to reduce your cortisol. Now, when the cortisol is going, your body is prioritizing fight or flight. It's not prioritizing healing. So staying positive and trying to stay calm and managing stress and all those things helps your body heal better, because your body doesn't like to heal really in a excited, stressed out state. It wants to be inflamed. It wants to send all kind of messages to escape and just focus on the most basic survival systems, not the repair systems. Okay. I'm also using cloves in my mouth. I forgot to put my cloves in my mouth. I use cloves in my mouth to relieve pain. And the cloves, eugenol, the oil in the cloves, also kills the Streptococcus bacteria in the mouth. And while I'm talking about the bacteria in the mouth, I had some posts previously about erectile dysfunction, and it's my understanding that there is a bacteria in your mouth that helps to produce nitrous oxide, which helps your circulation and helps the function of a man's machine. So I'm not prioritizing that right now. My priority is keeping my teeth, because if my machine is working and I can't eat, what it doesn't, it doesn't compute. Now, of course, I could get a denture. Yes, of course, I could get a root canal and a cap, or of course, I could get an implant. But I've heard of people getting implants and the implants falling out. Right? So that would indicate that the bone wasn't strong enough, or the anchor wasn't put in properly, or something like that. You know what I mean? So I'm not. I don't want to. I'm okay. Oh my gosh, these drivers are crazy. I'm good on the implants. Means that I'm cool on the implants. Means I don't want no implant. And I'm cool on the root canal. I don't want any root canal. Anyhow, so what else am I doing? Let's move along. After the cloves, let me just focus on these drivers right now, because they're bugging out. So so I'm using the cloves in my mouth. And then lastly, I'm using my own salve that I mix together when my tooth, when I think that, I'm blaming a lot on bacteria, which I'm blaming on myself, because I'm the one that's feeding the bacteria, right? So I blame a lot on bacteria, right? So I've created a salve that I feel attacks the bacteria and brings down the inflammation. I missed one of the ingredients that I should have wrote down here. But maybe about a year ago, I did a post about lowering cancer risk, and it's mostly pertaining to colon cancer, right? And there's certain herbs and spices that help to reduce cancer cells, or to kill the bacteria that are modifying your DNA and making your DNA mutate and causing your cells to mutate, or causing inflammation. Cytokines, inflammation, all of those things congregate at tumors, and you can reduce inflammation, and you can reduce the distribution of cytokines, which are things that I think the human body creates to attack injuries, basically, I guess. You can reduce the chance of tumors, basically, with certain herbs like cayenne pepper, garlic, ginger, cloves. But I would refer back to the episode, because I really kind of get into that specifically. It's called Reducing Big C Risk, and the other one is called CRISPR Chimera. So those are two episodes I'm kind of proud of, but those overlap in the herbs that can help you protect your DNA, and also not only protect your DNA, but also reduce inflammation, reduce your big C risk. All right. So in the salve that when my tooth starts acting up, I apply this salve, and it contains baking soda, 2% iodine, iodized salt, garlic powder, ginger powder, cayenne pepper, clove powder, CoQ10, flaxseed oil, coconut oil, turmeric, and I crush up a zinc supplement pill in there also. And you can add peppermint oil if you want also. Peppermint kills bacteria. The only thing with peppermint, again, it's something that's more I don't want to be too confusing. So peppermint oil is fine for this goal, for this agenda, for this issue, cavities. So I apply that salve to my gum right above that tooth that's giving me issue. And my intent and my hope is that it absorbs, because the mouth is very absorbent. We talk about, I did an episode talking about how absorbent the vagina is. The vagina is 8 times more absorbent than the skin on your body. The anus has the similar absorbent properties. And I would assume the mouth has the similar absorbent properties because some medications are applied sublingually. You put the pill under your tongue and it absorbs directly into your bloodstream. Now so the anus or the rectum, the anus is more like the muscle, right? The rectum, the vagina, and the mouth. The drugs applied, those are suppositories. You know, you can have a suppository that goes in the rectum. You can have suppositories that go in the vagina. I was talking about the absorbance of the body. Their mouth is very absorbent. That's why they say that not brushing your teeth is linked to heart disease, because those same bacteria can get directly into your bloodstream. So your mouth is very important. Some people, some of the woo-woo people that I follow, some of the hippies that I follow say that all disease starts in the mouth. I can't really, I don't think that's absolute. But when you think about it, you know, if you have, you got to be careful what you put in your mouth. You got to be careful what goes into your mouth. You got to be careful what you say. Anyhow, so the salve contains, again, baking soda, 2% iodine that I got from Amazon. I forgot what the name of the company is. Iodized salt, garlic powder, ginger powder, cayenne pepper, clove powder, CoQ10, flaxseed oil, coconut oil, zinc pill, crushed, and peppermint oil. Now, talking to AI, I found out that CoQ10 helps to heal your gums, strengthen your gums. So I have a CoQ10 eugenol. There's different types of CoQ10 supplement. From what I'm digging up, the eugenol CoQ10 supplement is more bioavailable. You can research that yourself, but there's certain CoQ10 supplements that are more bioavailable. Bioavailability is very important. You can get supplements that don't deliver directly to you. Now, I'm also, you know, I'm not a big proponent of processed stuff, but sometimes you got to do it. I'm not anti modern medicine. I'm more anti the exploitation, the financial exploitation, and the stiff-neckedness and the limiting of points of it that doesn't allow the exploration of alternative methods. Now, there's something I forgot to mention now. Zinc, different forms of zinc. Some forms of zinc are not safe to apply topically. They could harm you. Zinc oxide is not necessarily poisonous, but you don't want to put it in your mouth. So if you have a zinc supplement pill, that's what I would use. And that's what I use in my little situation there. Zinc kills bacteria, and I'm hoping that it works in that way. Now, there's also another vitamin that I'm going to be implementing. I just ordered it off of Amazon. I don't know if I ordered the right one, but I've been hearing about it on Instagram. You know, I say that I'm not susceptible to influencers, but that's not true. Adults are easily influenced also. So there's a vitamin called K2. Now you can get K2 from a plant-based source by eating fermented foods like sauerkraut, and the other one I can't remember. It's a form of fermented soy, and also tempeh, which is another fermented soy product. So tempeh and sauerkraut are great sources of K2 in a plant-based source. K2, supposedly there's different forms of K2, and I'm going to tell you what K2 does. So there's also, and there's different forms of K2. There's K2 MK4 and K2 MK7, which supposedly, from my limited understanding, you can't really get from plant sources, in a significant kind of way. But tempeh and sauerkraut are great sources. Now, sauerkraut is great for a lot of things. Sauerkraut also contains vitamin C. It contains a lot of different vitamins. So fermented foods are mostly, from my limited, I think sauerkraut is European. Tempeh is an Asian thing, I think. From my limited understanding, Japanese people have less instances of cavities. AI says it's because they drink a lot of green tea and they don't eat a lot of sugary stuff. But it's possible because they eat fermented soy. But anyhow, K2 allows calcium to fix to teeth and bones instead of fixing to soft tissue. And what's the example is your kidneys. Now, when calcium congregates in your kidneys, you get kidney stones. That's soft tissue. Your kidney is soft tissue, right? But you want the calcium to go to your bones, and you want it to go to your teeth. You want it to go where it's supposed to go. So, according to AI, K2 is a tried and true, or is a proven vitamin that will assist in supporting tooth health, bone health overall. So I need that because the bone at the root of my tooth is compromised with infection, and I need to strengthen my teeth. At the beginning of describing the things that I'm doing to improve my oral situation, I did mention that I'm using a hydroxyapatite toothpaste, and I think it's helping. But that's part of positive thinking positively. That's part of placebo effect, but placebo effect works. So I think I'm on a great path. But ultimately, my hope is to get a onlay, which is where they drill the tooth, drill away the bad parts, and then they glue on an epoxy glue substance. So, doing some more digging, the other day when I went to the dentist, and the dentist called her office a holistic dentist office, I was disappointed that the holistic dentist was offering me root canals and to remove my wisdom tooth. I'm a hippie woo-woo weirdo, and I'm not interested in any of those things. I'm not interested in mercury. I'm not interested in fluoride. I'm not interested in root canals. I'm not interested in removing my wisdom tooth. Now, what I discovered talking to DeepSeek is that there is another form of dentistry called mimetic. I don't know if I'm saying, is it a mimetic dentist? Let me look at my notes. Just give me 1 second. Biomimetic, right? So bio is I guess body, I guess, or living or whatever, living life. Bio is life, right? And mimetic means like copy. So a biomimetic dentist tries to keep everything as close to natural as possible. So that's the kind of dentist I need. A holistic dentist just doesn't use mercury and fluoride. They're not really all that wonderful. No disrespect to them. I'm sorry. No, I don't mean that. They're not interested in woo-woo hippie kind of stuff like I am. They're not doing woo-woo hippie stuff. They're doing non-fluoride, non-mercury. That's really just about it. But the biomimetic dentist does other stuff. Some of them use ozone. Some of them use ozone water. Yeah, the ozone water helps to clean things out better than peroxide. They may use low-level laser therapy. So low-level laser therapy helps to strengthen the pulp. Low-level laser therapy at 850 nanometer wavelength gets down to the dentin and strengthens it. There's different low-level light therapies. At the 600 nanometer level, it helps to strengthen your gums and the enamel. But at 850 nanometers, it gets down to the dentin and down to the pulp and strengthens those. It's similar to these light caps that people are wearing to regrow hair, and people are using low-level laser therapy for all kind of different things, for skin conditions, all kind of different things. Now, me personally, I'd rather just use the sun, but I don't know. Let me try to use the technology in a way to optimize my health, and just, I don't want to be too weird. Okay, so I also ordered a low-level light therapy, low-level laser therapy. It's probably not a laser. It's just like a red LED to put in my mouth and try to help me with that. Now, it's not gonna necessarily help regrow my tooth, but there's multiple things that I'm trying to do. I'm trying to heal my the bone. That's what the K2 is gonna help me do. I'm trying to kill the bacteria. That's what my salve is gonna do. I'm trying to strengthen the other interproximal cavities that I have. That's what the hydroxyapatite is gonna do. I'm flossing my teeth, so I'm trying to be preventative going forward. Did I mention the K2? The K2 is going to strengthen my teeth from the inside and the outside, supposedly, and my bones. I'm going to use the low-level laser therapy to strengthen my dentin and my pulp. Now, another thing about the biomimetic dentists, they do partial pulpectomies. Partial pulpectomies. Yeah, I might not be using the right word. So instead of destroying or drilling down your whole nerve, they'll just cut off the top. They'll just cut off the top of the nerve so that they'll have space to fill in the tooth and rebuild it, instead of drilling all the way down and killing the whole nerve, right? So that they can make space to restore and rebuild the teeth they'll cut off some of the pulp at the top and turn it into, and just put a synthetic material across the top of the tooth to fill it in. Like I said, my tooth is pretty compromised. Fortunately, it's still holding on. I'm probably not going to be able to put a lot of pressure on it going forward in life. Probably going to just be able to eat soft materials on that side. Not crushing any chicken bones anymore. Not chewing any ice with it. Not opening any cans and bottles with it. That's probably what started me off. Not stripping wires with my teeth anymore. I used to do that. That was probably a bad idea. Yeah, not doing anything, not eating any burnt up food that's too crispy, But that's okay. As long as I can get my nutrients and I'm not in pain, and I think I should be fine. But there's a lot to know. There's a lot to learn. But one of the takeaways I want to give is look into the biomimetic dentists. If you want to try to keep your teeth, please have your teeth inspected. Maybe, don't wait for 20 years like me. Maybe, I don't know. I mean, this cavity has been coming on. I mean, if I did an inspection every 2 years, I'd probably be in a better place. So if you can't do it once a year, do it at least every 2 years. Don't consume too many sugary snacks. Sometimes you're dealing with, I don't want to say anxiety, but sometimes you're trying to distract yourself with eating and grazing, and just consuming, and just having sugary stuff to just, keep your mind off of stuff. And I found that my attempt to limit my food intake, I'm not limiting my food intake. When I have my dinner, I'm having all of my food, my snacks, everything, all at one sitting, so that I can brush and then I don't have to do it again. But it really causes me to be hungry, because my history for the past few years has been to graze all day, to eat all day, snack all day, never stopping eating. Like whenever I'm bored, I'm gonna eat. Now cutting that out has made me feel like I'm going through withdrawal. And another thing I've noticed about myself is that my face has become my cheekbones have become more pronounced. So my overall calorie intake is definitely reduced. My overall calorie intake has definitely been reduced. And it seems like, your body takes about 4 hours to digest your food. When I'm eating at about 11 o'clock, 12 o'clock, between 11 and 12 o'clock, and then I'm eating again around 6 o'clock. So I'm eating like every 6 hours, and then I'm fasting from 6 o'clock in the evening right back around to 11 o'clock the next day. So it's kind of intermittent fasting, and I have a coworker. He only eats one meal a day, and he doesn't look like he's falling apart. He doesn't look like a skeleton. But I'm understanding now probably why he does it. It could be because his teeth are uncomfortable, and it could be to optimize his health. But hey, I've got to go. I thank you so much for listening. Look into biomimetic dentists. Look into coconut oil pulling instead of peroxide. Look into just trying to make sure that you get a dental checkup. At least every 2 years, I guess. If you can't do it once a year, at least do it every 2 years, so you know what's going on. Don't let them force you into doing anything. I never like any kind of medical whatever, or any professional, not even a car mechanic, forced me into doing anything. Nobody forced me to do nothing. I don't like it. Do your research. Don't get too crazy about social media like me and follow just because it's on social media. Don't be bugged out like me. But I hope you have a great outcome, and try to stay away from the sweets. It's hard. I go into the supermarket, there's sweets everywhere, there's candy everywhere, there's so many treats everywhere, and that's the problem. Because I was in the office, they had treats. I started indulging on the treats from August right around to about March, and here I am now, using the sugar as a drug, using the sugar as a coping mechanism. Anyhow, thanks for listening. Bang.